Good evening, everybody. We are going to look at a topic in medical surgical nursing under gastrointestinal tract disorders. We will look at common diseases of the stomach and the duodenum. Common diseases of the stomach and the duodenum, such as gastritis, gastroenteritis, peptic ulcer disease, gastrointestinal bleeding, and stomach cancer. We are going to start with gastritis. What is gastritis? Gastritis can be defined as the inflammation of the stomach, the inflammation of the stomach mucosal lining, inflammation of the stomach mucosal lining. What are the causes? Gastritis can be caused by drugs such as non-steroidal anti-inflammatory drugs, e.g. diclofenac, piroxicam, aspirin. Bacteria, e.g. Helicobacter pylori bacteria. High concentration of acid or base, ischemia, septicemia, and so on. The pathophysiology. The pathophysiology of gastritis. The stomach wall is protected by a barrier such as mucus gel-like substance, which protect the mucosal lining. Adequate blood supply to the stomach keeps the stomach firm and active. The integrity of the stomach can be affected when the protective wall of the mucosal lining is affected. Gastritis occurs when the protective lining of the stomach is affected. This occurs when the patient takes drug for a very long period of time. Drug like NSAID, that's non-steroidal anti-inflammatory drugs. These non-steroidal anti-inflammatory drugs erode the mucosal wall or destroy the jelly-like substance on the wall of the stomach mucosa. When this gel is destroyed, it exposes the mucosal lining, thereby causing erosion and inflammation of the stomach. Bacteria like Helicobacter pylori can affect the mucosal lining. When these bacteria invade the mucosal lining or gain entry into the lining, it results to autoimmune response. That is, the antigen, there will be antigen and antibody reaction. When the bacteria overpower the antibody, it will now result to inflammation. And this inflammation in the wall of the mucosa of the stomach is known as gastritis. This can also be caused when there is ischemia of the mucosal lining. That is, when there is no adequate blood supply to the wall of the mucosa. It will now lead to gangrene, that is deadness of the mucosal lining. This deadness can result to inflammation and it will now affect the digestive activity of the stomach. Septicemia can also result to gastritis. Septicemia is bacteria or virus or any other microorganism in the blood. When this microorganism is conveyed to the stomach via the gastric artery, at the arterioles or the smaller blood vessels of the stomach will now supply this mucosal wall. This will now result to autoimmune response, which will lead to inflammation. What are the common signs and symptoms? The common signs and symptoms of gastritis. It is very, very important to note these key signs and symptoms. 1. Vomiting. 2. Gastric pain, especially epigastric pain. The patient may also have symptoms of like loss of appetite, nausea. There will be fever. When the temperature is checked, the patient may have temperature of 38 degrees centigrade and above. There will be general malaise, restlessness, and so on. The complications of gastritis. Some of the common complications of gastritis. If gastritis is not treated, it will result to peritonitis, gastrointestinal bleeding, peptic ulcer disease. We're coming to peptic ulcer disease and also peritonitis later. Peptic ulcer disease and peritonitis are the common complications of gastritis. What are the common medical management? The medical management of gastritis, mostly antibiotic drugs and pain relief drugs are usually prescribed. The nursing management. The nursing management of gastritis. 1. Health promotion. The patient should be educated on personal hygiene, food safety, such as the food should be well protected. Advise patient not to have exposed the food. Sometimes the patient may want to eat vegetables or fruits or some food that you don't need to peel before you eat. And educate the patient about measures that can be taken, like washing the vegetables with salt to prevent or to inactivate the bacteria on the food. Regular hand washing. And educate the patient on regular hand washing. And educate the patient on proper food preparation. Food like meat. Meat should be properly cooked. Milk should be properly pasturated before consumption. Make sure the milk you are taking is not exposed to bacteria. Milk safety is very important. And educate the patient, even when they are traveling, the type of food they eat is very important. Where they eat the food, the type of food, how did they prepare the food is very important. And educate the patient on the lifestyle. Alcohol can be a cause of this disease. And educate the patient to avoid taking of alcohol. Drug administration. Administer prescribed antibiotics, prescribe pain relief drugs. And educate the patient on how to stay safe from consumption of anything, drugs that is not prescribed. Drug like non-steroidal anti-inflammatory drug, which may be a cause. The patient should not take drug like non-steroidal anti-inflammatory drugs. Advise the patient on environmental sanitation for food safety, so it will reduce breeding ground for flies. Teach the patient on the prevention of this disease by regular eating of food, by eating vegetables, or any disease that will make him to have ischemia. That should be avoided. When there is low blood supply to the GIT, it can affect or it can cause inflammation of the GIT. So the patient can take vegetables. There are some food that are so hard on the stomach. This can precipitate the pain. So you have to educate the patient to avoid eating food that may enhance or increase the pain. You can give the patient diversional therapy to reduce pain. Diversional therapy, like let the patient watch movies that he likes so much, listening to radio, or games that may take his attention away from the pain. He may be anxious. When he is anxious, you can give him psychotherapy. Some may have fear of unknown. This stomach pain that is disturbing me, what will come up of me? What will be the outcome of this disease? Will I die? So you can introduce the patient to other patients who are healed or who have been treated from this disease. Thank you for listening. In the next class, we'll look at gastroenteritis. We'll look at gastroenteritis. You can like, subscribe, or ask questions on my channel. Feel free to ask any question. Thank you.